Okay, good morning, folks. My name is Daryl Carver. I am Communications Director over at Fulton County Board of Health, and we have the announcement today about the free COVID test kit distribution. Just kind of give you a little order of show. We're going to start with Chairman Pitts, just kind of setting up how this program is working with the county. Then Dr. Lynn Paxton, Director over at Fulton County Board of Health, and then Dr. Pamela Rochelle. She is Chief Operating Officer for Fulton County to talk a little bit more about some of the other program aspects. So I'll start with Chairman Pitts.
Good morning. Thank you so much for being here with us this morning. As was indicated, I'm Rob Pitts. I chair the Board of Commissioners of Fulton County. And this is another big day in our county, Fulton County, Georgia. And I always say that Fulton County is really, really a big deal. This morning, I want to share some important information with you. It's an update on where we are that will benefit thousands upon thousands of residents of Fulton County who want to be tested for COVID. As you know, we have at Fulton County, we've led the state and even been a leader nationally with respect to testing, but also with respect to vaccinations. And this is another step in the right direction for Fulton County. Pleased to announce that we will now have, I think we've ordered in excess of 100,000 of these home test kits that we will be making available on a first come, first served basis to citizens of Fulton County. I want to repeat that number now. I think we've bought in excess of 100,000. That combination of what we've done at Fulton County and what the Board of Health has done as well. So we are out front, once again, leading not only the state of Georgia, but also one of the top tier counties in the country with respect to fighting COVID from a testing point of view and a vaccination point of view. So again, this is the latest effort on our part to take government to the people directly with these home test kits. So with that, I'll turn it over to Dr. Paxton, who will go into more detail about the program.
Well, thanks, Chairman Pitts. Well, I am equally as excited to be here to be announcing this really important initiative. And to let you know, the Fulton County Board of Health is working along with Fulton County government and with a substantial grant from the Centers for Disease Control and Prevention, which has provided us with a health equity grant, which allows us to bring more services to those people who have to date perhaps benefited less from the various options that are available. And so we use some of that equity funding to purchase, along with the county, these tests. And so this health equity grant targets those who are most at risk, including people who are experiencing homelessness or who are living in under-vaccinated areas or places where we have a lot of cases of COVID. And so this close coordination with the county allows us to have a much greater reach. And so we are now able to make these test kits available to all 15 cities and inside all of the 6 commission districts in Fulton County. And so I just want to stress that for people, these tests are very useful and they're very accurate. And the reason that we want people to have easy access to them is because by using these tests and monitoring if you have symptoms or if you think you've been exposed and monitoring whether or not you're positive, this puts you in a position where you can take quick action, such as if you are positive, you should isolate from other people. Everyone should be taking precautions anyway. The most important precaution one can take is to get vaccinated. We know from Fulton County data, this is not nationwide, this is from here, right here, that you are much less likely, if you are vaccinated, to get COVID in the first place. Should you get it and have a breakthrough infection, you are way less likely to be hospitalized or to die. About over 90% of the people that are in our hospitals right now or on vents with for COVID are unvaccinated. So this is still largely a disease that is affecting the unvaccinated. So please get vaccinated. If it has been more than, if you have finished your primary series, but it's been more than 5 months, please go and get a booster shot. That even increases your protection. So please do that. You can look on our website and find all of this information about vaccinations, where you can get them. You can also find information about where you can get formal PCR testing. And then Dr. Rochelle is going to be talking about where you can go to get these rapid test kits to stay at home. And what I will say before turning over to Dr. Rochelle is that beginning tomorrow, the Fulton County Board of Health will be resuming issuing $100 gift cards as incentives to people who are coming in to get vaccinated for either their first or their second dose. And this is going to be at 3 locations in Fulton County, at our Stonewall Tell location, at College Park, and at Adamsville. So again, please go onto our website. This will be up soon, and so you can get information about this very important initiative. And what I am going to say is that, and I just want to remind people that these are very safe and very effective vaccines. The last thing I'm going to say is that we have these test kits available here. Dr. Rochelle will be telling you more about where you can get them. But I also want to say that besides the locations where we'll be giving these tests out, the federal government also has a program that will send 4 test kits to a household. And you can go access that by going to covidtests.gov, covidtests.gov, as an additional source to get rapid test kits. And so now I'm going to turn over to Dr. Rochelle. Thank you.
Thank you, Dr. Paxton. Good morning. So where can Fulton County residents pick up a test kit? They are available starting today at 10 o'clock, and it's during the operating hours of 15 libraries. So not every single library in Fulton County. We've specifically targeted 15 libraries so that there is an access point in all of the cities in Fulton County. So for more information about where those libraries are, as well as the health centers, there are 6 health centers, please visit fultoncountyga.gov/home test kits. You must pick up a test kit in person. They will not be mailed. You must pick up a test kit in person, and it is 1 package per individual, and it's while supplies last.
All right. Questions for Dr. Paxton or Dr. Rochelle? That would be very thorough.
I know Dr. Paxton had talked about the health equity grant funding, and I think either Dr. Paxton or Dr. Rochelle can kind of go on this. That funding targets communities like the one we're in right now. This is low. This is a low vaccination tract, and if you all can go into that.
Absolutely. I mean, we were really excited that we were able to successfully compete for this grant from the CDC for the amount of several $1 million. And it is linked to our being able to improve getting services to those people who need them the most in terms of COVID at this time. But what we know from is that many of the things that we're doing to improve access to COVID prevention and treatment in the long run will also help with getting access to other forms of treatment. So we're for other conditions, not just COVID. So we're extremely excited about this. Again, as was pointed out by Mr. Carver, we're standing in an area that unfortunately has both high COVID rates and low vaccination rates. And so this is the type of community that we really want to get out into and to really target and to bring services to them. And in fact, that's why we have we have these vaccination centers that are located here in this particular area. This vaccine is free to all. If you are a Fulton County resident and you are getting your first or second dose, then you are eligible for the $100 incentive that I just spoke about. And this information is all very readily available on our website. So I just encourage people to inform themselves, to go to these trusted sites to learn more about COVID and to find out where you can get these test kits and where you can be vaccinated.
And I would just add that the partnership with Fulton County, our Board of Commissioners authorized use of our American Rescue Plan dollars so that we could make test kits available not only in the health equity communities, but at an access point across Fulton County. And so that's why this partnership is so incredible.
I have a question about boosters or first shots in general, I guess. How soon are we recommending that folks go get a booster or go get their first or second shot after they've had a case, say they got Omicron this winter?
Okay. Yeah. Well, actually, that's a very pertinent question because the CDC has just clarified a number of things, which is very helpful. One thing that they have, what we've noticed that, again, boosters improve your odds of not getting ill. And for a while, they had said, so basically for a while they'd said 5 months after completing your series of either the Pfizer or the Moderna vaccine, you should get a booster. And 2 months after getting the single shot of J&J, if that's what you had gotten. But now they have just recently shortened that period, so you can get a booster, the third dose, at 2 months after any of these. Okay, that's important. Another thing that is also changed is that previously, if somebody had COVID and had received monoclonal antibodies, it was advised that they should wait 3 months afterwards, 90 days afterwards, before getting vaccinated. That they have now, research has shown that that's not necessary. And so actually, as soon as, if someone's had COVID, as soon as they're feeling well, they can go get vaccinated. And we encourage that. Why do we encourage that? Because we know that a significant number of people who have had previous bouts of COVID are getting reinfected. Yet you cut that down if you get vaccinated. So basically, the important things are that if you've had and been infected with COVID and you've recovered, you can get vaccinated right away, and you should get vaccinated right away. And the interval for getting your booster dose has been shortened. You can get it, as early as 2 to 3 months after having your second dose. If, however, and I should mention this, if you, however, are moderately to severely immunocompromised, so for example, if you're undergoing treatment for cancer or you're on steroids for whatever reason, then you should go ahead. They've even now said that you can get a fourth dose should you want to do that. But that's for people who are moderately to severely immunocompromised, which is basically not most people. So those people are encouraged to get a fourth dose. But for the rest of us, it's really get that third booster dose, which will really improve your chances of not getting sick at all. But I do want to stress that even if you've only had the primary series, that still affords you a very, very, very good protection against hospitalization or becoming very sick from that. So I just want to counter this prevailing talk that goes around when people will come to me and say, well, if I could still get COVID despite being vaccinated, why get it at all? The reason why you get it is because it reduces your risk of getting infected at all, getting the infection at all. Should you get it and have a breakthrough infection, it reduces by anywhere from 20 to even 50 times your risk of dying from COVID. Now, those are excellent odds. Now, why would you not want to take them? So again, I want to stress that vaccinations, they are free, they are safe, and they are effective, so everyone should go out and get vaccinated.
Other questions?
Yes, Chairman Pitts, there's two bills. There's a Senate bill and a House bill to make Fulton County Commissioners nonpartisan races. Can you comment on that?
I'm not aware of it. Jesse, are you aware of it?
I can.
I've got some details. There's SB 437 and HB 1244.
We can, I can quickly speak to that. I'm Jessica Corbett, Director of External Affairs. Senator Albert's bill last week passed out of the Senate with a substitute that, instead of being a nonpartisan bill, introduces a redistricting map. We have been working with our delegation on redistricting, and that's what Senator Albert's substitute is a redistricting map based on a map that was unanimously voted on by the Board of Commissioners. Representative Dreyer also has indicated that his bill was not intended as a nonpartisan election bill, but was actually intended to introduce redistricting. They had a clerical error or a procedural error in the hopper, and that's what occurred. So they issued a press release about that last week, and that is what he has communicated to us. So that's what we expect to happen in the committee this afternoon.
All right. Thank you very much. So, these are the kids here.
Yes. Yeah, those are the kids. Should, they're actually very easy to use.
This was,
Yeah. And so, very, extremely simple. So you just pick a little swab, stick it in there, and then in 15 minutes later, it tells you. I hope you should have some company. You gotta be employee, you gotta be, yeah.
all right.